Okay, hi, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything that we see is magnified 30 or 40 times on the screen. Right out of the gate, we can see your biceps tendon anchors loose here, so we're going to do a tenodesis. We're also going to need a number 1 PDS marker stitch for the cuff because there's a question of some tearing there, which is what we expected. First step is to take a spinal needle. We'll need a shuttle relay. And that spinal needle comes through. You'll see that come through the biceps tendon right here. There's one pass through. We'll take a shuttle relay. Careful here. You're going to have to come closer and turn this way. Okay, so we'll take hold the camera please. We'll take a black wire called a shuttle relay or a super shuttle. And we'll pass this down through. There it is there. We'll take a grasper. We'll reach in here and retrieve the relay. Now what we're going to do is use this to pass some suture through the biceps tendon. And the first step of that is what you're going to see right here. There's the suture going through. So now we're going to take the spinal needle one more time through, and we'll use the shuttle relay again. Here's a second pass through. And now this time we're going to pass quite a bit more of the relay through because we're going to take it behind the biceps. So we'll hold the camera just like that. You can see we're passing a lot more of the relay through. Now we'll reach in and we'll retrieve it here. This time though, we're not going to pull it out right away. We're going to go ahead and slip around behind the biceps like this. What this does is it gives us a stronger hold of the biceps tendon. Okay, so we'll go ahead and load that. And that gives us a very strong hold as we pull tight. You watch that loop tighten up. See how it tightens up there? That looks good. We're going to go ahead now and take a pair of arthroscopic scissors and cut the biceps at its base. Hold right there. And this is the first step in the biceps tenodesis. We're going to release it here inside the joint. So we'll cut way down here. And now the biceps is released. So we'll use a shaver now to smooth out what's left behind here. There's our shaver coming in. Trying to focus a little bit better. Okay, and now that the biceps is not attaching there anymore, this should be fine. We're going to go ahead and look down the back of your shoulder. This posterior capsule looks good. Posterior joint looks pretty good there. I don't see much in the way of loss of cartilage, which is a fancy way of saying I don't see much arthritis. And the anterior structures are actually checking out pretty good as well. We're going to rotate back up and look at this rotator cuff again. And we're going to take a spinal needle and pass it through the area of the cuff that I think has the most injury. Which is going to be this little thin area right here. This may be something we have to worry about. It may not. And so we're going to bracket this. Just like that. We're going to pass one. And then in a second, I'm going to need a relay. we'll pass this purple suture called a PDS. I'm going to pass that through. Okay. Grasper, please. Okay, that's good. That's good. I got it. Okay. And pull out the needle. Okay. And now we're going to pass that relay one more time, pass the suture one more time using a relay. Okay, here you can see how we're just hugging the edge of the rotator cuff footprint here. We'll take our grasper. Yeah. Pull out the needle. Okay, so here you can see our marker stitch right there. If we have to tie that, we always could, and that would give us a little ripstop stitch just like that. But at least now we know where that portion of the cuff is. We're going to go off on the video and change positions with your shoulder next. Okay, we're in the subacromial space, so we're up above the rotator cuff. I just wanted to show you that you've got significant tearing on this side. See how this tendon's pretty beat up. The marker stitch, which we just took out, was right here. And so this is where we're going to unroof the tear. And I think you'll see in a second is that this is going to be substantially more torn than you might otherwise guess. So there we are. See how that's all not great tissue there. And so we're going to hopefully give you a much better repair by using the full thickness of the cuff and anchor that back down to the bone. Okay, so we're ready to start placing some anchors in just about, I think. We'll show you some more in a minute. Okay, so we've got our guide in. You can just see it there. We're going to tap down the anchor. I'm holding it in position. Go ahead and tap slowly. Hold on. Hold on. Okay, let's do it there. Go ahead. Okay, we're all done here. We're taking a quick final look through the cannula. So I'll take that out and show you what it looks like here. There's the repair. That looks good. We put in a pop lock anchor to secure the biceps. And you can see that right there. That's holding down the biceps tendon in the front. And then there's the sutures for the cuff. We'll go ahead and take the burr, make sure there's nothing else with the bone that we need to worry about. We'll show you some more. Actually, this will be the end of it because there's really not much more surgery left to do. So good luck to you now. Bye-bye.